The steps to do a pelvic examination or pap test smear will be to explain the procedure if the patient is unfamiliar with it and answer any questions, and then set up the table and equipment as the examiner prefers. Provide the patient gown and ask that all clothing below the waist be removed and the gown put on so that it ties in the back to provide privacy. When the patient is ready, assist onto the table with the lower half of the body covered with the drape. Assist into lithotomy position with feet in the stirrups and buttocks right at the end of the table. The knees should be apart. The drape can be left free or positioned so that the corners can be wrapped around the lower legs and feet with the third corner hanging over the perineum. Reassure the patient and help her relax during the procedure by telling her to take a deep breath, slow breaths through the mouth, and to try to relax the abdominal muscles. Assist the examiner by passing equipment as requested. Apply gloves and fix the slides by flooding them with 95% ethyl alcohol and spraying them with cytology fixative according to the directions on the spray container. If a thin prep container or solution was used, just close the container. When the procedure is finished, help the patient slide back, pull out the table extension, and remove the feet simultaneously from the stirrups and lay them straight on the table. Ask the patient to slide back down onto the table. When the patient is ready to sit up, assist to a sitting position as you slide the table extension into the table. Allow the slides, if used, to dry for at least 5 minutes before packaging them into the slide container to send to the laboratory. Send the labeled container and then requisition slip to the laboratory. The doctor should always have a female assistant with them for the pap smear test or pelvic exam. And then the supplies I would use for giving a pelvic exam and pap test smear would be the gloves, saline solution, examination table with stirrups, examination light, vaginal speculum, biohazard waste container, cotton tipped applicator or cytology brush, cervical scraper, a patient gown and drape, a lubricant, examination stool, a glass slide from the frosted edge or thin prep specimen container, a pencil, a pathology requisition slip, and a cytology fixative.